Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
18-year-old girl complains of severe pain with menses for the past 4 years, which is slowly worsening. The patient was advised NSAIDs and oral contraceptive pills, which she has taken for the last 2 years, but it is not relieved by them. Her urinary pregnancy test is negative. What is the next best step in the management? The next best step in the management is here the patient has severe dysmenorrhea and then still it is not relieved by NSAIDs and OCPs. So this will point towards the endometriosis, and in such case we should perform diagnostic laparoscopy. You are
thank you and thank you for watching.